your hand. Come to join with us, ICD. Give us your hands.
Good evening. Welcome to our monthly webinar. This is for the month of August. So for tonight, we have very interesting topic. We're talking about aesthetics in maxillofacial radiology based on 3D printing. Tonight webinar is going to be delivered by Professor Dr. Zainul Rajiun. Prof. Zainul is currently the professor at the Kuliah of Dentistry, International Islamic University. And he was formerly from the School of Dental Science, University of Science Malaysia, and formerly Deputy Dean of Research and Innovation and leads the Craniofacial Imaging Center. Prof. Zainul was seconded from USM to Oral Radiology Unit, Department of Maxillofacial and Diagnostics, College of Dentistry, King Saud Abdul Aziz for Health Science, Riyadh, in United Kingdom of Saudi Arabia, as visiting professor and academic staff from January 2015 to June 2018. He obtained his grad diploma certificate and PhD in oral maxillofacial radiology at the University of Adelaide, Australia. His research interests include 3D craniofacial reconstruction, applying craniofacial deformity, applying CAD/CAM software. He was sponsored by the Malaysian Biotech Corp to do the Certificate of Entrepreneurship Learning from University of Cambridge, United Kingdom in 2009. He is a recipient of various research grants, includes Australia Dental Research Foundation grant, Yayasan Felda, Fundamental Top-Down grant, Ministry of Higher Education Malaysia, IRPA grant, Top-Down, eScience from Ministry of Science and Technology, and Cradle Investment Fund and Research University Team grant. He is also examiner in undergrad and postgrad level in Malaysia, Indonesia, Australia, and Saudi Arabia. He was the Senate member of USM from 2017-2019. He was the founder of Editor-in-Chief Archive of Orofacial Science, and currently is Corpus Index, and also official journal of School of Dental Science, USM from 2008-2015. And at present, he is the editor-in-chief of IIUM Journal Orofacial Health Science and former president-elect of IADR Malaysian section. He is active member of the International Association of Dental Maxillofacial Radiology, ASEAN Pacific Craniofacial Association of ASEAN Oral Maxillofacial Radiology. He is also the reviewer of the National Journals of Assessor for grant application. So tonight, ladies and gentlemen, Professor Zainul Ahmad Rajiun will speak to us about aesthetic in maxillofacial radiology based on 3D printing. Professor Zainul, the screen is yours.
Thank you very much, Professor Dato' Muhammad bin Ibrahim. Can I have the slide? I have already put a slide, Dato'. Is it the slide is there?
No, you have to play back. You have to share.
Oh, okay. All right, fine. I thought it's already there.
You have to share back your screen.
All right. Is it okay?
We can't see the screen yet. Can you share?
Yeah, done.
No. At the moment, we are unable to see the screen.
you like to share again?
Yeah, yes, yes, yes. Tak ada ya?
Okay, no, not yet.
Sekejap. Okay. Tak dapat ya? No, you can't see, is it?
No, no, we still not visible.
Okay. What should I do? Should
You,
I?
you open your PowerPoint and share
Yeah.
screen.
Yep. 1 minute. Open the PowerPoint. Okay, just 1 minute. All right. Okay.
Then share screen.
All right.
Okay, Your Honor. Okay, go ahead.
All right. Thank you very much, Prof. Dato Ibrahim, Muhammad Ibrahim. Ladies and gentlemen, thank you for the kind words, Dato. I would like to thank the organizing committee for allowing me to present this paper, or this research, this presentation. First of all, I'm from Kuliah of Dentistry, International Islamic University in Malaysia, in Kuantan, Pahang. My first slide is basically a slide showing dentistry and beyond. I'm very sure you agree with me. We are basically not treating only in the mouth or the cavity. We are trained also to treat other craniofacial deformity, such as in all those deformities born with some other deformities like encephalosis, Crouzon syndromes, and Appiah syndromes with syndactyly. So this is an honor for us being a dentist. The knowledge that we have can be part of our multidisciplinary approach in treating this patient. So as you can see, I was trained in Australia, ACFU in Adelaide. We can see the importance of our profession in the team that play a very important role in treating this type of patient. I would like also to acknowledge this is the people who have contributed a lot to the development of science and medicine, especially Cormac and Housfield, Latimer and Mansfield, who invented CT scan and MRI, and subsequently these two save life. Definitely, as you can see, the importance of diagnosis depends on CT scan and also on MRI. On the advancement of this machine or these tools, basically we can see the radiological data converted to computer-aided design or computer-aided manufacturing. And the term comes in after that is additive manufacturing or rapid prototyping and biomaterial and 3D printing. So this is basically originated from data from radiology. So this is the importance of this machine for us to develop and innovate more science-based research so that this can save life of patient. Also, historically, as you can see, CAD/CAM or computer-aided design based on imaging data or radiological data arises from a very important person. I would like to acknowledge Vanier, Marsh, and Walden. Vanier and Marsh are surgeons. They basically work in St. Louis. St. Louis is the center for making F-15 or F-16 aircraft or fighter jet. And this, they maybe in the bar, they bump with Walden. Walden is basically aeronautical engineering. So they discuss about how they can, reconstruct facial based on imaging data. So on that note, I think they have produced some research, and this is the first few articles documented or published in radiology, there is a three-dimensional CT reconstruction image based on the craniofacial surgical planning and also CAT-scan reconstruction. So this is a few papers based on the imaging data and craniofacial reconstruction. As we can see about 3D printing. So I will go together. What do we mean by 3D printing? So 3D printing is basically a machine that can print some object. So Charles Hall is basically the first who invented this 3D printing. And as you can see now, we can see the advancements of 3D printing. You can see electron bone melting, or EBM, selective laser sintering, or object stratesis is part of the 3D printing that can read all the radiological data from CT scan or MRI. And also, I would like to introduce to you, for those who are newcomer, the word additive manufacturing, because this is also terms that play an important role to understand what do we mean by 3D printing. As we can see from this graph, there are a lot of demands on having 3D printing, not only for medical, but also for other industry like car making, research on science, for example. So this, from the graph, you can see most of the countries has now have their own 3D printing machine for the development of their product for medical purposes. So this is one of the example of EBM, object stratesis, and selective laser sintering. And this is what produced most of the implant. This picture shows the cranial implant and other mandibular implant, ear, nose, ear, etc., etc. As you can see from here, we can see some artificial, we can see some equipments or replicating human parts, such as for nose, ears, 3D models for tumors, replacing fingerprints, printing cars on broken limbs. So with this development or this innovation of technology, that means that patients who have some deformity, the corrective procedures of this deformity is based on the computer-based data or radiological-based data, the marriage between each other. And now we can see the term personalized specific implant, or PSI, is used. It is especially giving a optimal treatment and diagnosis for the right medicine or tools or devices for a right patient to meet the clinical requirement and characteristic of the patient. So this is what do we mean by PSI, or patient-specific implant. I would like to start off the importance of this 3D printing. First of all, this paper was published in New England Journal of Medicine 2013. A baby born with abnormality of the airway. So it's called tracheobronchomalacia. It's an abnormality of the trachea and bronchial. Baby names Kabia. She was born and she developed some airway distress and was sent to the hospital. And CT scan was done, and a 3D reformatting image is shown here. There is a collapse of this airway passage when the patient aspires. So aspiration is done, and we can see there is a blockage of the airway. And on that, surgeons and engineers came in, and what they have done is basically to save the baby's life. They have invented a 3D printing splint to make sure that the airway is patent. So as you can see, Kabia developed, progressed very well, and he's now, is able to live as like normal babies, and now he's without the tracheostomy. So this is the latest picture. This is the work done at University of Michigan. Scott Hollister and Glenn Green developed this Kabia splint. So in other words, 3D printing is not only printing biomaterial, but also they can save life. So this is one of the example, the importance of imaging data and also 3D printing. When we talk about 3D printing, we should understand a little bit the words biomaterial, because you have to reconstruct tools, for example, something which is related to, which is based on material which is compatible to human. This is called biomaterial. The development of biomaterial is quite advanced. We can see beside having autologous bone, there is a metacrylate, hydroxyapatite. Now we have a titanium, and subsequently latest nowadays they have a pig implant, which is part of resin. So this is all the implant biomaterial that is especially applicable for human. However, it's not easy to have such materials. I think Langer, researchers from MIT, has published a lot on how this can be applied for a scaffold to grow some human cells. So this is part of tissue engineering and regenerative medicine. So biomaterial is very important in terms of how we can apply that for the reconstructions of any abnormalities of humans' parts. So the advance goes very fast. As we can see, Richard Norris has his first facial transplant. This is done by Dr. Rodriguez from Maryland. He's an oral maxillofacial surgeon. So how important the maxillofacial surgeon, their skills in, having this type of surgery is not an easy surgery. So this has been done on Richard Norris, who have been injured by a shotgun. And this picture shows how 3D printing, how radiological data comes into very important, playing a very important role to make sure that Richard Norris have a normal life. And also 3D printing is not only used for facial, preoperative procedures, but also we can see for twin, Siamese twin attached at the head or the brain. The surgeons and the radiologists would like to discuss that pre-operatively, so they need to have a 3D models to mimic what is inside the human body. So this is the advantage of having this skull, 3D printing material. So not only in, we can see also for tumor, surgeons can have some visualization of the tumor based on the 3D skull 3D printing. And also we can also see the lower picture here shows injuries based on AK-47 bullets. So this can be brought to the court to tell the judge that this is how the injuries sustained by that particular victim. So this is some of the work that's been done. And I think that's when I was in Adelaide, Professor David used to have this 3D skull printed model prior to surgery and discuss with their registrars before going into the operation theater. I have the opportunity to attach with Jules, Dr. Jules Pokens, especially maxillofacial surgeon in Holland and Belgium. So he also he did some work on this 3D reconstruction, and a few papers was published with regards to mandibular reconstruction. This is a passively reconstruction, aims to maintain an airway, aims to have the proper mastication, chewing, and proper physiological swallowing functions play an important role. Therefore, they have reconstruct this mandible with titanium. And this is also have to be, they brought it to the theater for discussion before they do all the surgery. So this is another way of applications of 3D printing, not only for preoperative procedures, but also to maintain the physiological part of airway mastication and swallowing. Therefore, as you can see, the progress of 3D printing is very fast, and you can see computer-aided design and manufacturing published. And there are a lot of papers published, especially related to radiologists, also oral maxillofacial radiology. So in other words, we can see cranial reconstruction, 3D biomodel of a custom-built implant created using additive manufacturing. There are papers with regards to medical 3D printing for the radiologists. some overviews of how important is 3D printing for radiologists, not also for 3D printing for clinical application in ENT or otolaryngology, and also for dentistry. So in other words, I'm trying to tell you here with regards to the literature. So this 3D printing is not only applicable to medicine or surgery, but also for dentistry also. So this is some of the papers. And one of the challenge that we have basically when we are doing this reconstruction is basically a post-op evaluation or assessment. If you have, this is one of the paper published in Finland with regards to biomaterial. They use bioactive glass and PMMA to reconstruct post-cranioplasty patients with MVA. So the skull, temporal bone, and the parietal bones was missing, and they need to reconstruct for aesthetical purposes. So, and also to cover the brain, to protect the brain, because without the bone, the brain is exposed. So, however, they are not doing the conventional like titanium implant. They have developed a more biomaterial. They have innovated biomaterial, which is a medically graded biomaterial, bioactive glass and PMMA. But you can see patients is fine and aesthetically acceptable. However, we need to see the progress. So this paper mentions some of the importance of the progress of when you have implant inside your body. You need to see what happened, whether it is infection, whether it's a failure, whether it is in depression in that area. So radiological data is very important. So patient undergo post-op PET CT, or as you're aware, PET CT is basically using some radio tracer, radioactive material to see if there is any bone formation, any cellular activity or metabolic activity. So as you can see, the color coding here on the right shows that some metabolic activities is going on. And if you can see from the left, without the color coding, there is some bone growth, new bone formations with regards to the implant. So in other words, the post-operative assessment is very important radiologically to see the progress of this implant. I think this is the most important for radiologists, maxillofacial radiologists, to observe if there is any failure or rejection of this implant. So radiology must be one of the method for post-operative assessment. In summary, I can see that we can see that there is a proven uses of advanced manufacturing in complex surgery. This is a 3D CT imaging technology, 3D printing, and also we understand the importance of computer-aided design and manufacturing in other parts of the world. So that means that in other parts of the world, they have applied this technology for the medical application. And not only that, advanced manufacturing, but the software is very important. It is quite expensive investment, because you need not only to have a 3D printer, but you need also to have a software. So IT expert must come in, engineers, mechanicals, or any engineers who are good in software, they must play a very important role. So in terms of software, if you are you have a lot of money, you can buy some commercial software like Materialize. But if not, we use open source software, which is a bit user friendly, and it can be also applicable for 3D reconstruction of radiological data. Therefore, it needs an interdisciplinary expertise. Not only doctors, ITs, engineers, and surgeons must play an important role. And this is how the importance of PSI, patient-specific implant, personalized medicine, play an important role to make sure that patients have their optimal treatment and diagnosis in terms of applicable the 3D printing application. In summary, again, just to recap back what I have explained to you, we have the raw data from CT scan, MRI, CBCT. We need to have also software. Mimics is a commercial software from Materialize. 3D Slicer is basically from MIT. MITK is also from a German Cancer Institute. So this is some of the commercial and open source software. You can use this software, and also you need to have some 3D printer to fabricate. I mean, this you can transfer the data from DICOM into SLL, the language they are used for 3D printing, and can print any of your pre-operative model before you go for surgery or for some surgical simulation. In Malaysia, as far as we are aware, in early 90s, we don't have a 3D software, we don't have a 3D reconstruction. And for radiologists, I think it's not easy to interpret or to do reporting on some of the maxillofacial cases. As you can see, the right maxilla, the lesion of the right maxilla encroached into the left maxilla, and also involving the nasal septum. It's not easy to visualize everything based on 2Ds. Everything is in 2Ds. So this is the how when MRI, CT scan advancement goes on. So science improve, and that's how we can improve how we treat our patients. So initially, it's not that easy. And furthermore, the reconstruction of patients secondary to surgery, secondary to cancer, is basically all manual. Our technicians are basically trained to do this, but however, it's more handmade or manual made, and it's not patient-specific implant. This is still some parts of the world is still using this conventional method to do all this reconstruct patients with some lesions based on post-secondary to radiotherapy or surgery. In Malaysia, we can see there are a lot of, due to motor vehicle accidents, a lot of people die on the road because of accidents of the speed, for example. And not only that, there are a lot of cases with oral cancer, although it's not that high compared to breast or lung, but there is cases of all the cancers going on which need proper reconstructions after their surgery, for example. So this is some of the slides I'm trying to show you the importance of how 3D printing can help this sort of patient. One of the examples that I can show you, patients published, this is from newspaper, patients with severe injury secondary to motor vehicle accidents and MVA. As you can see, fractures of the skull bone involving the brain, hematoma, and also you can see that patients aesthetically is not acceptable. There are a lot of bones have to be removed because of the foreign body. So at the end of the day, patients doesn't look that good because of the reconstruction has not been done. So this is some of the examples of we need to have a proper methods to treat this patient with craniofacial deformity. Furthermore, the current supplies of implant is very, very expensive. Synthes, they have all this medical implant, cranial implant, which costs around 5,000 to 10,000 US dollars. Zillock from Holland, where I did some attachment. This is all quite expensive. It's not some of the patients can afford to have if they have a post cranioplasty with a depressed skull, doesn't look that nice, so they can't have a surgery because the implant is quite expensive. How this started, I did some attachment with Jews, as I told you, at the Belgium and Holland. This is in Maastricht. I visited Metrolize to see their software, and with me is a biomedical engineer who developed this Zillock company that supplied all this medical implant. And I did some attachment with Renadel Jacobs in Leuven, University of Leuven, on radiological part, and she also have some connection with a Metrolize company with regards to 3D reconstruction. So this is the things that you need to see what other parts of the world is doing, so that you can bring this technology to your country and then develop this 3D printing, because it's quite new in some parts of the world. So with that, in Malaysia, we do have government agencies having some 3D printing machine. They are basically used for medical and also for industry. SIRIM is one of them. They have an industrial automation and robotics program. They have a electronics intelligence systems and CAD/CAM program. And also 3D Gens, which owned by Dr. Izal. So he bought the first medical graded titanium. This is an ABM or electron bone melting. It's quite expensive, but we do have this in Malaysia now, medical graded 3D printing. And a Metrolize company, as I told you, in Leuven, Belgium, they opened a company in Malaysia to cater for all those 3D printing. For patients who need this 3D printing tools for reconstruction. So this is a development going on in Malaysia with regards to 3D printing. Just a slide to show you, if you're having some holiday, make sure that try to spend, now you can travel. So this is in Langkawi, you can go to Island. You also can visit Highland, that is in Genting Highland, and also in the mainland in Kuala Lumpur. So this is some of the pictures that try to promote some of the areas that you can visit in Malaysia. All right, what we have done in Malaysia, I would like to acknowledge my former universities when I worked there, School of Dental Sciences, University of Science Malaysia, and also I'm working at the moment at University International Islamic University. So we have our own research cluster, Craniofacial Medical Imaging Biomaterial Research Group. So this was started a few years back, and we have some examples to show you what we have done in Malaysia. Right. Before that, I try to make you understand the importance of data. We have all those radiological data, axial view with all the slices, because CT scan have all the slices, around 100 slices. So a computer need to make sure that the slices are staggered and also packed together. When they pack together with some software, they can form a full skull. For example, if you have a CT scan of full skull, this is a reconstruction of a full skull of data from DICOM format from CT scan, and you have to transfer that to STL or WLL, and then you can put it in some of a machine or 3D printing, and therefore you can print that data for your any work that you want to do for your medical purposes. So not only that, there's some things that maybe you need to do some landmarks procedures. For example, this is a patient with cleft lip and palate. You can see the severity of the cleft, and you can see the soft tissue. When you simulate this data, you can remove the soft tissue, and you can see the bone. You can delineate areas that you want to do, and you need to have some knowledge of the landmarks before you do some analysis, and also volume rendering. This is some parts of the work that I have done with my PhD student. And also it's not easy to do everything with based on commercial software. Metrolize is quite expensive. You have to pay annually fees, but open source, if you have an IT expert coming in your center, so you can do a lot of things based on the open source. This is one of the software that we have. There is a trimatic software, so we are trying to see patients with cranial deformity. We do some mirror image. We take some data from the on the area where there's no deformity. We do the mirror image and put it on the area that need reconstruction. So this is all a comparison between Mimics and MITK. How accurate is commercial software and open source? So we have done these studies, and we found out that open source software is compatible. It's comparable to be used or to be applied in any craniofacial reconstruction, and it also can be published in most of the papers, because they found that it's quite accurate in terms of error. Is less than 0.5, maybe 0.01. So it's something which is very accurate for surgical simulation. One of the example that cases that we have done here is basically patients with sarcoma, avian sarcoma. This is basically a cancer where you can see from this view, coronal view, there's some lesion, radiopaque lesion extended from the maxilla, going further up to the inferior turbinate and evaded the right mesory area. And you can see also from the axial view, there is some the extent of this tumor, and also from the sagittal view. So there is a destructive lytic sclerotic bone lesion at the right maxilla, infiltrated to the right nasal cavity at the inferior turbinate and displaces the cartilaginous part of the nasal septum to the left side. So you can see there is some deviations of the nasal, the nose of these patients toward the left. So this is some of the reporting that we have to make before any surgical procedures. So based on this data, we can see we can bring it to the software. There's a software that can visualize in detail of that particular pathology. So the lesion does not extend basically to the maxilla or on the palate. It's still intact. However, it goes beyond the nasal cavity and also to the floor of the orbit. So and you can do some reconstructions on this. You can see clearly the extent of the tumor based on this 3D graphics or 3D reconstruction. You can also include the soft tissue. You want to see the soft tissue. So this is some of the method or some of the software that you can utilize to visualize the pathology of the patient. You do the mirror. This is one of the patient. We do a mirror image. We did a mirror image on the left and transfer it onto the right. We remove it. We crop the data. We remove the lesion, and then we bring it to the 3D printing. We print the skull, and we put a titanium mesh. For the surgeon, it's quite easy for them because if they have the skull model in front of them, so they can make such they can see the extent of the mesh before they put it on the patient. So it's quite easy for them. And when they put it on the patient, they save a lot of time. So 3D printing basically save time for the surgeon when they are doing the surgery. Post-op patient. Post-op we can see patients can open the mouth. There's no more, and the nostril is a bit symmetrical. So this is some of the improvement of this patient. Also, we can see the orbital floor defects after extensive mastectomy can cause severe aesthetic and functional deformities. Reconstruction after extensive mastectomy with individual titanium mesh fabricated using computer-assisted techniques can preserve globe projection, orbital volume, resulting in successful clinical outcomes. So the results of the surgery is very important with regards to the tools that we have, with regards to the technology that we have. Then with regards to the time of surgery, these all factors contribute to the success of the surgery. However, we need to have a scan, a post-op scan of this patient being done after a few months to make sure there's no reinfection, to make sure that the titanium mesh is intact on the floor of the orbit. So this is the importance of how we can see the evaluation or the assessment of patients with craniofacial deformity based on radiology. So this is very important that a patient have this CT scan data post-op to see whether there's any infection or any failure of the procedure before. This another case I would like to present to you with regards to this applications of this 3D printing and radiology, especially patient 59 years old male complaint of swelling on his forehead. I think the swelling was there for many years. This is how the patients hesitate to come for medical treatment, but at the end he came. You can see this is a frontal sinus mucosal diagnosis. It's a herniation of brain tissue. It's a non-pathological herniation of brain tissue, and the CT scan data, as you can see on the lateral part, lateral view, there's a capsulated border with regards to the frontal lobe. That means that the brain is intact. the lesion or the pathology does not extend to the brain, and this is one of the benign cases. So we can see from here, the neurosurgeon must come in, and also the maxillofacial surgeon will do all the reconstruction, but we must make sure to protect the brain. That's why this is a multidisciplinary approach, how the tumor can be removed. Before that, we have to transfer the data to the software, and we need to do some pterosaur. As you know, CT scan have some pterosaur, the bone pterosaur and soft tissue. We need to remove the soft tissue and just remain the bone. And with that, before we do transfer it for printing, this is some of the analysis that should be done before we send it to printing. So this is using Mimic software, and you can see from here, from DICOM, we have to change the data to STL format for the 3D printer to read and to print the 3D biomodel of the skull. And with that, this is our object 3D printing available at our faculty, and we can print, and after that, the surgeon will bring it to the theater. And this is a maxillofacial surgeon for Saiful, and others are doing the work. Then we need to make sure that the skull is with us, or in case we need to see the extension of the tumor. And this is one of the procedures that's been done, and remove the tumor, and we can see the titanium mesh is inserted on the frontal part of this patient. And we can see the post-op data. Everything is intact. The frontal sinus is intact. The brain all intact. So, in other words, the operation was successful. This is another case of mandible reconstruction. As you can see, this is embolioblastoma, bilateral expansions of the cortical and cortical destruction with septa calcification. A typical case of soap bubble appearance of this. We can see from the corner view of lesions of this embolioblastoma. It's quite extensive. Patient have a big swelling on the chin, and we do some reconstruction. So this surgical approach is using a fibula free flap as graft, and then in other words, we have to make sure to resect the embolioblastoma and make sure that the area which is not affected by the tumor must be safe. So if we can see from here, the mandibular and the condylar and the ramus is intact. So in other words, half of the mandible has to be removed, and therefore a surgical simulation has to be done. So this is one of the method that the surgeon will come in first to see what they need to do, or they need to do some bilateral resection, mandibulectomy resection on the both side, and then we need to do some virtual replacement. So the remaining part of this mandible and the condyle must be there, and then we insert from our database the mandible, the size of the mandible of this particular patient. We insert to this from the database. We put it in the visually to this particular case, so we can see the size of that mandible, and this is how it looks like when you do some reconstruction, and this is how it looks like where you have to cut. I mean the resection area. So we developed the 3D printing modeling was done, and the mandibular model and the cutting guide was manufactured by the 3D printer. The titanium reconstruction plate was pre-bent along the contours of the model. So the surgeon can do some surgical simulation before they do real surgery. So this is to show you the fibula bone graft. There you can take some of the parts of the fibula and then with all the arteries and the veins intact, and put it in the mandible. So this is some of the examples of the mandible reconstruction. Patients did well and everything was fine. I don't have the data post-op. This is another case. Before this is few cases that I'm going to finish soon. Just to tell you that this is some of the manual method of doing a patient with post radiotherapy secondary to squamous cell carcinoma. So we can see the lesion here is a big lesion. We can see the cavity at the right areas of the cheek, involving not only the zygoma that goes deep into the maxilla. So this is some of the method that we want to compare to tell you that this is one of the previous methods have been done. However, with all the technology that we have, I'm trying to show you a video of how we reconstruct this using 3D printing technology. So this is basically CT scan data, and from each slices we need to do some contouring of the area that we need to reconstruct. So we need to close the defect using this is basically using software, so MITK, and then we can close the roof, all right, and then slices. After that, we fill out defect in the axial sagittal plane in a slice by slice, all right, and then you have to go a little bit downward with regards to the view from the, you are doing from the axial view, but you can see from the sagittal view where which area that you are doing. So it must be a very meticulous. It must be slice to slice data. So you can see from here just to make sure that all are filled. So there's still you can refer to the axial view on your left, where is the extent of the processes that you are putting in. You have a complete design. When you have a complete design, you go for 3D printing. So you send for 3D printing, and you have to have a mold of this particular patient, and you need to reconstruct using silicone resin. So, and then you insert it to the patient with regards to the silicone manufactured by 3D printing. This is some of the example showing some medical data. I would like to share with you because this is something which is quite interesting. I think in certain countries they have some archaeological skeleton. So in Malaysia we found archaeological findings, or we call it Perak man, and this is the age of this particular skeleton is around 10,000 to 11,000 years. So it was still intact, and the archaeologists, Prof Mokhtar and his team has taken the skull and basically brought to us for reconstruction. We scanned the data, we scanned the skull, this Perak man skull skeleton, and we reconstruct using additive manufacturing and 3D printing. This is one of the national interests has been discussed about this Perak man, because they found that this is one of the earliest civilization that came to our country. So we need to make sure that we do it right to interpret the data. So CT scan was done on this data using 3D CT and 3D computing, and we developed the potential phase of this data using expert from Brazil. So we published this paper. So our colleague from Brazil, his expert is basically on reconstruct soft tissue. So it's not easy to reconstruct the soft tissue because we have only the bone. But with his expertise, we can develop a potential phase of this particular man, which is around 10,000 to 11,000 years. So this is the phase of this Perak man, and then we have published this paper in one of the international journals. All right, so this is one of the examples of the Perak man, and they also found some Pawon man in Indonesia. If you have some, I think some colleague from Indonesia, maybe this is another collaboration that we can have. We can see how the skull look like of this Pawon man, and we can make some comparison with our skull from Perak. And also in Thailand, they have Ban Pon Mano. I found the names there. Maybe that can be also some comparison. And from there we can hypothesize that the people coming to this part of the world, peninsula part of Southeast Asia, basically people who have the same, could be the same body size or same brain volume, for example. So this is something that we can do some research on that. So therefore, I think I just 45 minutes. I think already 10:18. This is my last slide. I would like to thank all of you. This is some of the language that you use, maybe Shalom, Gamon, and Kelimamon, Kapjai. I know Shukriya is quite easy for me to pronounce that. And I would like to take this opportunity to thank you all for listening to my talk. Thank you very much.
Thank you very much, Professor Zainul, for a very interesting lecture. And we have with us tonight the Vice President of ICD Section 15, Professor Arshad Malik. Welcome, Professor Malik. Okay.
Yeah.
He got something to ask, but before that, we have a question from one of our attendees tonight. Professor Zainul, this question is, how many % is the model accurate?
Yeah, thank you very much for the question. That's very important before we start any study. We need to see the error. So as far as publication is concerned, based on the software, it's not based on the what we are doing, but prior to using that software, we must make sure that the software is accurate. So we did some trial to see whether there's a lot of error. So we found our results are quite consistent and concur with some other publications that have been done on the same software. So in other words, if you can't, you want to see how much, definitely for medical dental purposes, it should be less than 0.5 millimeters. So it comes out to be less than 0.5. Some will be around 0.2 or 0.01. So it's very accurate. So that's why we think this it's important to apply this the software. I mean, before we do the reconstruction. Yeah, it's very accurate and less error. Yep.
All right, thank you. Professor Arshad, you got something to ask to our speaker? No. I think Professor Arshad only want to ask something just now. It's okay. With regard to PSI just now, for Zainul, how is in Malaysia? How is the frequency use of PSI in management treatment? Yeah,
the term PSI is a general term. I mean, it's specific example for population, for Malays or for some other for Chinese Indians. So in other words, it's also personalized medicine. So in other words, it's not only surgery but also for medicine. But for surgery, it's basically cater PSI means that implant or anything given to the patient will be with the right optimum size, for example, with aesthetically acceptable compared to other methods, because other methods are basically, we don't have a 3D software, it's more on 2Ds, and sometimes you can see cranial implant without 3D software, 3D construction, you can see it's not symmetrical, for example, because they are all in 2Ds. They don't have a XYZ coordinates where they do the recontouring, the contour of the skull cap, for example, because there's some concavity. So with that we mean by PSI, basically patient specifically implant dedicated to that particular patient with right size, right height, right breadth, right contour, so aesthetically acceptable. So in other words, this is we mean by patient-specific implant or PSI.
Okay, thank you very much. And then we have another question from Dr. Ahmad Badruddin. How did you plan for the amyloblastoma case since cannot mirror due to the very large lesion?
Yes, that's why that I show you that's been done. Basically, you need to have a bilateral resection of that tumor. So you need to have a database before you reconstruct that particular mandible. So that database is basically based on our population, based on the size of the face, for example, based on the breadth or the width of the condylar, the bicondylar width. We can measure the width of the condylar head, the coronoid head. Then if we measure, we can find from our database which is mimics to that particular patient. So from there, we took that mandible and superimposed on this visually superimposed on this particular data or patient. From there, we do some crop, we did some cutting a little bit to make sure the size is suitable for that particular patient. So a lot of simulation has been done, and also we can reconstruct the soft tissue to see whether we can have the data, because the patient have the soft tissue data. So we also check if the soft tissue data. So when everything is on the right place, on the measurement is right, then that one we transfer using a titanium mesh to make sure that the mesh is basically with regards to the fibular grafting, for example.
Sorry that there was a
so that's how we
misconnection
do
of
it.
the internet. Datu Ibrahim?
Okay. Professor Zainul was responding to one question just now. It's okay. Sincere. I mean, you got anything to ask from Zainul? Professor Malik?
Yeah, actually there was problem in the net, and I have to shift the laptop. Sorry that actually I was traveling, and during travel I have stopped, and I have listened the gentleman so wonderful presentation. After a long time I have listened this type of a presentation of 3D reconstruction. Being maxillofacial surgeon, that it is a wonderful presentation. Rajiun, I think that you have done a marvel. Your cases were very good, especially last case of reconstruction and especially reprinting. My question is that being sitting in Pakistan, we have facilities of 3D printing, but the expense that is matters a lot. What do you think in Malaysia? Comparatively, can the patient affordability for the 3D printing is there? And if the patient is not affordable, what do you used to do?
All right. Thank you very much, Prof. Malik. Shukriya. Thank you very much. First thing, I embarked on this first research. I travel. We have a grant from the government, so we travel to Europe and also with our maxillofacial colleague surgeon to see what they have done, especially in Holland and Belgium, with regards to 3D reconstruction. And then we came back. The first thing is that number one, you need to have a software. You need to buy a software because you have all the sophisticated 3D CT scan, for example, MRI, all are there. But if without a software, you can't do the 3D printing. So the first thing is you need a software, and with the software, they can read the DICOM format from CT scan and change to STL in the 3D printer. So the 3D printing can read all this data. Number two, you have to have a 3D printing to print that particular model. So you need to have 3D printing. So for that 3D printing, number one, the purpose of 3D printing is you need to have radiological data to do some simulation. This is basically surgical point of view. You want to simulate something, you can see from the data, or you can print that data based on any 3D printing machine. There are quite numbers of machines that can print all data based on material. You can have a resin, you can have PMMA, you can have a polyethyl acrylate, all types of material that can be produced from the 3D printing. So you can print that and you can do some studies or pre-operative observation. However, if you want to do some titanium mesh or titanium reconstruction, you can take that titanium and look, you can measure the titanium based on the model that you print. So that can be done. However, titanium is not that cheap. You have to buy the titanium. Okay, that is basically for. But nowadays we have EBM. It's basically we have in Malaysia now. Electron bone melting EBM is basically for titanium. If you have a medical graded, which is a powder-based titanium, you can print and you can, because it's medical graded and produced in a sterile 3D printer, you can bring that directly to the patient, like cranial implant, mandibular implant. That can also be done directly to the patient as long as you have that 3D printing machine. So that one is quite expensive. I think. But in Malaysia, some patients afford. They have some insurance. They can have that implant. But this is basically cater for, unfortunately, patients with MVA, motor vehicle accidents, for example. So some of them, they have insurance, they can pay. But if they can't, then we use a normal routine procedure. Maxillofacial surgeon use some titanium mesh, all these things. So that's how, in terms of payment, depends. If they have insurance, they can pay. But the procedure is going on well. I think the patient can afford to pay, as far as I'm aware. So here in Malaysia, we can still pay that. Yeah.
Zainul, actually, I will just continue to your answer that in the very initial stage of 3D printing, when the people started the 3D printing in wax, and then they started the silicones, and then they come for the sophisticated materials like you mentioned. And these days, what do you think that yet these previous silicones and other things are feasible for the 3D construction or not?
When you talk about silicone, silicone is more like an what I can say is more like impression material developed you can do for your I mean, but when you talk about nowadays, we not titanium, the most advanced material is PIC or PICA. PIC is a polyethyl acrylate ketone. So this is all basically a replacement for titanium. So I think in terms of material, silicone is basically more, I mean, it's low level compared to nowadays. We have PIC or PECA, PIC or PECA. Yeah. Beside titanium, if your patient don't want titanium, they can have a resin, PIC or PECA.
Thank you, Dato. Especially, we are very much thankful to our chairman, the scientific committee, that he used to organize such an excellent, and I don't know from where you get these excellent heroes from the Malaysia Academy, that so beautiful presentation. And it is congratulations to all the organizing committee, especially.
Thank you very much. Thank you.
Thank you. We have another two questions, in fact. In fact, one of it you might have answered just now, for as I know. I think the question is, beside titanium, what other material used for reconstruction? I think you did mention in the previous statement about other materials beside titanium, right?
Yeah.
So, yes. And then the other question is from Dr. Fuad. He's talking about what about small defect like periodontal disease? Can this also be applied?
I mean, depends on what is it a periodontal? I'm not sure periodontal disease is it pocket or something that bone missing. This one, I don't think so. We need to go to the 3D printing because maybe it can be inserted directly based on the hydroxyapatite bones replacement or substitution of bone, like hydroxyapatite, for example, or calcium carbonate. But because if you talk about 3D printing, you need to have a radiological data, which is something which is you need to have a big lesion, for example. You need to construct based on accuracy, for example, like PSI, for example. So that is the lesion that we look into when we do 3D printing. So not a small lesion like periodontal disease.
Okay. All right. Thank you very much, Professor Zainul, for a very interesting lecture. And of course, now PSI, regard of PSI has touched a lot of things can be done with help through this, especially the maxillofacial surgeon. Using PSI, they can design the treatment before even they operate on the patient. Right?
Yes.
Okay, I think it's very interesting. Thank you very much. Again,
thank you very much.
On behalf of ICD Section 15, we'd like to thank you for your excellent presentation tonight. So thank you again from all of our team from ICD Section 15. As usual, I will announce for our September lectures. So in September, we will have our speaker from Indonesia, Dr. Kevin Kewilarang. The topic is about veneer preparation less is more. This one we do it in conjunction, collaboration with the Indonesian Prosthodontic Association. So please do join us again on in September the 14th, same time, with topics on veneer this time around. So again, thank you very much all for joining us. Thank you, Professor Zainul, and all the Professor Ashad Malik, and also all the members from our team, myself, Dr. Mayuna, and Dr. Amy, the Education Committee. Well, thank you for joining us, and we'll meet again in next month, inshallah. Till then, good night and have a good rest wherever we are. Thank you and goodbye.
Thank you.
Thank you.